This is my 21.2 presentation on age. Aging is a degenerative process that can affect lots of different things within the body. It can affect our muscular system, our neural system, skeletal system, and cardiovascular system. There are a few different types of aging, and there are different things that are affected by each one. The first one is chronological age, and this is your age in years, so how long you've been alive for. There is also your physical or biological age, and this is how old your body seems or acts. For example, you could be 50 years old, but your fitness levels and the state that your body systems are in, that can mean that your body's age could be 90. Or it could be lower than your actual age. And this can mean that your body can start to lose cells and the organs in your body aren't as efficient as they should be for your age. The next type of aging is called social aging, and this can make you act much older or younger depending on the social expectations. And the last one is called psychological aging, and this can result in changes in your memory functions. For example, you might not be able to remember a lot of things that you did recently, and it can also affect how well you cope by yourself, and you can become much more reliant on other people that you have around you to help with everyday tasks. A lot of sports are related to different age groups. Some of the sports that are typically done by the younger generations are football, rugby, gymnastics, sprints and basketball. And some examples that are typically done by the older generation are golf, darts, snooker, cycling and long distance running. There are a few different things that can be affected by your age and things that will change in your body as you get older. The things that can be affected are your skeletal system, muscular system, cardiovascular system, respiratory system, endocrine system, and your body composition, metabolism and thermoregulation. As you get older, the density in your bones decreases, and this can lead to osteoporosis. This means that your bones become more fragile and they can break a lot easier. And also, as a result of aging, the cartilage in your bones gets a lot thinner, and this then means there is not a lot of resistance at the joints, and the bones will be at higher risk of rubbing against each other, and this can cause quite a lot of damage to the bones. Older people can also suffer from osteoarthritis, and this means that your joints will be a lot stiffer. An athlete that suffered with this was called Ledley King, and he was a footballer who had to retire early due to developing osteoarthritis. When your cartilage starts to thin, it can lead to the joint stiffening, and a way to help this is to do lots of swimming, and this is because it isn't a weight-bearing exercise and doesn't put any pressure on the joints, and it makes the joints able to move a lot easier. Also, by doing a lot more swimming, it will create more synovial fluid, which will help the joints to stop rubbing against each other. You can also get a surgery to replace any cartilage that you have lost if it is causing you a lot of problems and pain. Also, by doing some light jogging, it can increase the amount of calcium intake, and this can help to make the bones a lot stronger and less brittle, which would be helpful for someone who suffers with osteoporosis. Moving on to the muscular system. People will start to experience muscle mass loss when they get to the age of around 45, and then when they get to the age of 70, men will have lost 4.7% of their muscle mass, and females would have lost 3.7% of their muscle mass. There is a lower intake in protein for older people, and this can affect the body because the proteins help to repair the muscles if they have any tears. It can also help to repair the tendons in the body as well. At least 50% of the muscle mass loss in older people is as a result of disuse, and this can be improved by regular walking, whether this is walking the dog, walking to the shops, etc. Also, the number of motor units that you have start to decrease as you age, and this then means that any signals that are being sent to the muscles will take a lot longer to get there, and this can result in having a slower reaction time to things. Another thing that will decrease with age is the number and size of your muscle fibres. Another thing that can affect the muscular system, can have an effect on you because of your muscular system, is having a decrease in mobility as you get older, and this can then result in them having a loss of independence. And also, due to a decreased level of mobility, this can result in a loss of flexibility and movement of any joints as you age. With age, your heart will start to lose its elasticity. It will increase in stiffness, and then this means that the diastole phase will be limited and the heart won't be able to contract as efficiently. Also, there will be an increase in blood pressure. The baroreceptors are less sensitive, and this can lead to developing hypertension, which is when your blood pressure is at 160/90. The increase in blood pressure is due to arteriosclerosis, which is the hardening of the arteries. When the arteries have hardened due to this, it means that the arteries aren't as flexible and they won't be able to vasodilate or vasoconstrict as much, or at all. A few other things that can happen are your capillary walls will thicken, and as a result of this it will make gaseous exchange a lot more difficult, because there will be more material for the oxygen to get through before it can be transported through the blood. Also, your blood vessels will become less flexible, and this will make blood flow a lot harder, and it will require more effort from your heart so that the blood can be transported. Your cardiac output level will also decrease because your heart will have to work harder, but there won't be a lot of blood being pushed through it because the blood vessels are thicker and the blood can't travel as fast. This can cause blood pooling, and this is a result of the venous valve deteriorating, and this means that there will be a backflow of blood. The SA node can also start to lose some cells as you get older, and this means that the signals that are being sent around the body will be delayed. There will also be less fluid or plasma in the body, and this can result in blood volume decreasing. Also, the level of red blood cell production will be lowered because there is less oxygen that is being carried around, and this then makes it more inefficient, and this can affect your aerobic capacity. To be able to find evidence of cardiovascular system being affected with age is by looking at the normative data for a multi-stage fitness test and for the VO2 max levels. This would be good to look at because the older generation will probably have lower scores on the MSFT, and this is because their heart isn't as efficient at pumping blood around the body quick enough, and this means that the working muscles won't get the required amount of oxygen that they need to work to the maximum level. Also, their VO2 max will be very different to younger people because their respiratory muscles will be weaker as well as their heart, so they won't be able to take in, transport or use as much oxygen. The common problems that come with the deterioration of the cardiovascular muscles are angina, and this means that there is a partial blockage of fat in your arteries, which will reduce the amount of blood flow. Angina is a warning condition, and it can lead to full blockage of an artery, and then this can lead to a heart attack. Another common problem is called anemia, and this means that you don't have enough iron in your body, and this can be due to a lack of hemoglobin and less red blood cells, and it can cause you to look quite pale as well. To prevent any of these things from happening and reducing the risk. You can try and maintain a healthy diet, don't smoke, and increase the amount of exercise that you do, and have regular checkups on your heart. As you get older, your respiratory system can also be affected. When you get to the age of 25, this means that your lungs have fully matured. Your respiratory muscle strength will start to decrease as your age increases. There will also be a decrease in lung tissue elasticity due to the increase in collagen. The collagen will harden the respiratory muscles, and this is because it is trying to make them stronger. This can then affect the tidal volume, which means that there will be less air being taken into the body per minute. The older generations will also have a smaller vital capacity, which means that they won't be able to breathe in and out as much air as they possibly can. At the age of 35, the shape and the amount of alveoli that you have in your lungs will decrease as well, and this can then cause your peak airflow to decrease. The reduced level of the peak airflow means that your respiratory muscles aren't as strong. A good example for this would be to look at normative data for peak flow, and then the graph will show that as you get to the age of 30, your peak flow will start to decrease. To help keep your respiratory muscles strong, there are a few exercises that you can do. The first and the most simple one is to do regular exercise so that you can keep the respiratory muscles working. The second is diaphragmatic breathing, and the last one is doing interval exercise or having regular rest periods while you're exercising. A few things that can happen as you get older are that your VO2 max levels will decrease by 10% every decade after you get to the age of 30. Your heart rate will also decrease with age, and this can be a result of the lungs not taking in as much oxygen because the muscles are weaker, and this means the heart doesn't have to work as hard to get the oxygen around the body. Another thing that can be affected by age is your recovery time, and this means it will take longer for your muscles and breathing to return back to their resting levels after exercise. The endocrine system is a messenger system which is controlled by the hormones that maintain homeostasis. As you get older, the amount of hormones that you have in your body will decrease. Also, the receptors that you have in the remaining hormones will be less sensitive, and this means that they will become less effective. The hormones that will start to decrease as you get older are called estrogen, which is mainly what women have, testosterone, which mainly men have, growth hormones, and melatonin. If there is a decrease in the growth hormone, then this means that there will also be a decrease in muscle mass and muscle strength. The amount of estrogen hormones that women have will decrease due to menopause. The decrease in melatonin can affect your sleep pattern and you won't feel as awake or alert. And the decrease of testosterone in men can cause a lower efficiency of the male reproductive system. There are a few things that can be done to restore the hormones that you lose. The first is called hormone replacement therapy, and this can be beneficial to older people. Men could have more testosterone and women can get more estrogen. However, for postmenopausal women, HRT can be quite harmful, and with the decrease in hormones in your body, it can affect how much we exercise, because we won't have as much energy due to the lack of melatonin. However, it can also cause some psychological harm, and it can affect your confidence quite badly. Body composition is the percentage of fat, muscle, bone and water that we have in our body. As you age, the amount of fat that you have will start to decrease at the abdominals for men and the hips and thighs for women. It can increase the chance and risk of developing cardiovascular diseases and diabetes. Your fat mass will also start to increase as you get into your 40s, and then it will start to decrease again when you get to 75 to 80 years old. It will increase due to the change in your diet and the amount of exercise you are doing regularly, and it will increase due to having to do more exercise due to having a decrease in appetite as you get older.